Hearing problems can be serious health problems. Hi, I'm Hainan with Hainan's Ear Tips, where I bring you tips and tricks about better hearing with or without hearing aids. A lot of people think that hearing problems are just simple little difficulties, just part of getting older, where you have to strain a little bit or listen a little harder, and often also think that hearing tests are just something that measures how bad your hearing is. Well, it is that, but it's a lot more than that. In a hearing test, I watch for 2 handfuls of what I call red flags. These are potentially serious health problems that you need to know about that show up when we do a full hearing assessment. So what are they? And why did I say 2 handfuls? Well, the 2 handfuls part is just a way of saying there's about 10 of them. And what are they? They fall into 3 categories. Number 1, what you tell me. So when you come in for a hearing evaluation, the things that you tell me about yourself, about your hearing problems, the things you write down on the form or the case history, there's a few of those I'm watching for that are specific red flags. Also, what I see. So when I look at your ears, when I look in your ears, there are things that I can see that if I see them, they are concerning. And number 3 are some things that I discover or learn when I do the full hearing assessment. A lot more than just the beeps. And I'm going to tell you about those now. So the first category, what you tell me. If you tell me you've had a sudden drop in hearing, especially if it's been in one ear only, that's called sudden hearing loss. It sounds obvious, but it can be a medical emergency. If you tell me you have tinnitus or tinnitus, people say it differently, in one ear only, especially if it's pulsing, that could be a sign of a serious blood pressure problem, could be a potential aneurysm risk, and I'm mentioning the super scary ones. There's a whole bunch of different things that could point towards things which I am nowhere near qualified to diagnose, but are worth having your physician explore. And dizziness and balance problems. A lot of people indicate that they have some chronic, or some people I should say, will indicate they have some chronic dizziness problems or balance problems. Again, those can be related to deeper health concerns that your physician needs to explore and clear you for or treat. So I review the case history, I review the things you tell me, then I start having a look. I'll have a look behind your ear to see if there's any scars from a previous surgery, which likely you would have told me about it because you would likely know about that. I'll have a look in your ear, and I'll be looking for inflammation. I'll be looking for foreign objects, big plugs of earwax. You wouldn't believe the stuff that we've seen in people's ears, from bugs to batteries. I'll be looking for active drainage. That's another thing you might tell me about, is bleeding or drainage. I'll be looking for discolored eardrums, for growths in the ear canal, all kinds of stuff that if I see these things, again, it's beyond my qualification to treat or even properly diagnose. So again, I will refer you to your physician. Then when I do the hearing test, this is the third category, I can learn some things. And what do I watch for? Well, I watch to see, is your hearing sensitivity balanced? We have 2 ears, and in theory, they should both be relatively the same. If I find that you hear really well in one ear and not well in another, and this is something you might not know because it might be a huge difference in your hearing at just one pitch, which might be actually hard for you to tell yourself. But if I see that, that could be a sign of a tumor growing on an ear nerve, among other things. It may not be a concern, it might be, or it might be. But again, it's beyond my qualification to diagnose that. And I'm not going to try and scare you. I'm simply going to say, because your hearing is so unbalanced, you should see a doctor about this. And speaking about imbalances, we also do speech testing, where I have you repeat words to see how clearly you hear them. And if you have balanced hearing sensitivity, but your speech comprehension is extremely unbalanced, again, that's a red flag. That's something that could be a serious medical concern. Possibly a growth on one nerve causing the signal allowing the signal to be heard by the brain, but causing it to be distorted so you can't understand it clearly. So again, that's something you'd want your physician to know about and you'd want to explore. And the final thing that I watch for is something we call technically an air-bone gap. Don't worry about that. What that simply means is we test hearing sensitivity two different ways, through the ear canal and on the bone. Through the ear canal means the sound has to go through the ear canal, vibrate the eardrum, and go through the little chain of bones to the inner ear, which attaches to the nerve. That's where we really sense the hearing. And that goes on the nerve to the brain. So with the hearing tests, we do a couple of different tests. We go the normal way through the ear canal, but then we also do the bone, which bypasses the eardrum and the whole middle ear area and stimulates the inner ear directly. If you hear way better directly to the inner ear than you do through the whole normal ear, that suggests something between out here and the inner ear is slowing it down. And when that's the case, sometimes it's medically treatable, sometimes making it so you don't even need hearing aids. So that's something we want your doctor to know about as well. So as I've mentioned already, whenever we learn about any of these potential problems, whenever we see them, we're not diagnosing them. We might suggest to you what your doctor might look for, but our main goal is to make sure that either those are corrected so that you don't need any more hearing help, you don't even need hearing aids in some cases, or potentially serious medical conditions are discovered and treated before hearing help is talked about. So I'll prepare a report with your permission, send it to your physician, and this actually helps the physicians out, because in many of these situations, if you go straight to the doctor, which I'm not discouraging you to do, but if you'd gone straight to them, your physician may send you back to us for a diagnostic hearing evaluation so that they can learn the information they need to make an appropriate diagnosis. So I just want to leave you with the thought that hearing tests are part of your regular health checkups. And so I encourage you to have hearing tests for your health.